This video is going to show you the sort of things that I would normally put in a medical pack for travellers going to Africa, Asia or South America on usual types of trips. I would recommend you put all your medications in a bag, and ideally that bag should have a large green cross on it, which is the international symbol for first aid. That makes your kit look more proper and you will have possibly less problems going through customs. There are 4 groups of problems that travellers get when they travel: gut and stomach problems, respiratory, chest and sinus problems, wounds and injuries, and pain. The most common problem that travellers get is gut problems, and this is the group of drugs that we normally use for this condition. The most important gut drug of all is your antibiotic. It varies depending on which country you are visiting, but the antibiotic is designed to kill the germ that's causing the diarrhoea and makes you better. We also need to take an antibiotic with a stopper, and that makes the antibiotic stay in your gut longer and makes the antibiotic work better. The other drugs that are sometimes useful for travellers are vomiting pills like Stematol, Buscopan, which is good for stomach cramps, rehydration salts such as Gastrolite to rehydrate you if you've got a lot of fluid loss. Sometimes people get indigestion, and so something like Quickies or Mylanta is worthwhile. And Simplatan or Tinidazole is an antibiotic that treats a different type of diarrhea germ. And we'll talk about that a little more in the other video. The second group of problems that travellers get is respiratory or chest problems. And the pills that you need to have with you, just in case, are first of all sinus tablets, so that you can clear your nose, antihistamines, some sort of throat lozenge, and most importantly, the antibiotic for chest infections. You may not need to use this, but if you're stuck somewhere and you can't get to a doctor, that can get you out of trouble. The most common one that we use is Rulide because it's once a day for 5 days. The next set of problems that people develop are pain, and pain can come in various formats. I tend to put things like Panadol in the medical kits because Panadol will treat many different types of pain and is very safe. But some travellers will take with them other forms of pain relief. The last group of problems that travellers get is injury or wounds, and so it makes sense to take a range of dressings and antiseptics, scissors, tweezers, even a sling or a bandage. The other things that can be useful in your medical kit are an antibiotic drop for eye and ear infections called soframycin, and then things like sunscreen, insect repellent and hand wash. It also pays to have a medication guide so you know how to use many of these things, because some of these drugs will be unfamiliar, and you need to have a letter that says you're carrying these drugs on medical advice, so when you go through customs you're not going to get into trouble for having little blue pills.